Good evening, everyone, and welcome to the VA Long Beach Women Veterans Town Hall. I'm Alyssa Rebus, VA Long Beach's Deputy Public Affairs Officer and an Air Force veteran. Thanks for joining our live interactive call. So we've got a great agenda for you all this evening. We'll do some interviews, some polls, and during that last portion of the call, you can ask questions. We'll try to get to as many as possible and follow up on any that we can't. If you ask a personal healthcare question, we may not be able to answer due to HIPAA constraints. We will review all comments and follow up as needed after the town hall. If you're on your phone and you want to watch the stream, press *8 for a link via text or visit access.live/VA Long Beach. We're also live on Facebook. You can see us there at VA Long Beach Healthcare System. To ask a question, press *3 anytime and you'll be put in line to ask your question or leave a comment. If you're watching online, just type your name and question below the video. We're only taking questions on the website, but Facebook questions will be answered afterward. All right, now I will go ahead and hand it over to Lori Rudisil, our Women Veterans Program Manager.
Hello, everyone. I am Lori Rudisil, Women Veterans Program Manager, and I want to recognize that it is Women's History Month, and I cannot think of a better way to honor that than by speaking with woman veteran Raine Jackson. Thanks for being here.
Oh, thank you so much.
Before I jump to questions about yourself, my first question is related to your experience here at VA Long Beach as a woman. Have you ever been called Mr.?
Yes, I have.
Can you explain what happened?
I signed into one of the services office where I needed assistance, and I believe they just asked for your last name and your last four, or they might have asked for your first name. I can't remember, but I know when the person came out to call my name, they said, "Mr. Jackson, we'll see you now," and I just sat there because I said, "Well, I can't be talking to me. There must be another Jackson in here." But it was me, and they did apologize.
Yeah, I'm confident we're going to come to a day where women veterans coming to VA Long Beach will no longer be called Mr. We do train all new employees to, do away with those salutations, and let's just say Veteran Jackson.
Yes.
All right. So tell me about your experience in the military.
Well, I was an enlisted soldier. I served in Germany, in Desert Storm, White Sands Missile Range, Los Angeles, and here in Long Beach. I really missed my time in the service. I was glad for it. So I went through trials and tribulations while in there, but I do think that they helped make me a stronger person.
And how long did you serve for?
Almost 20 years.
Wow, that's amazing.
Yes.
Yeah. Any experience you care to share that stand out to you?
I think the biggest experience that I like to share is that while I was overseas, I did enjoy my time with my unit because we had a lot of camaraderie. I was assigned to an explosive ordnance disposal unit while I was in Germany, and when I was told that I could come back, I was ever so grateful that I was able to come back to Germany. I would say the one thing that did disappoint me was that when I was re-enlisting, they had stated that I was going to be reassigned to Hawaii. And I was in Hawaii for as long as my name was on the line until they pressed that button. Then I went to White Sands Missile Range, New Mexico, and I cried for weeks. Other than that, once I got over that initial shock, I was fine.
That's great. Thank you for sharing that. So tell me, how long have you been receiving care here at VA Long Beach?
I've been receiving care here at the VA Long Beach probably since the late 90s, or almost the 2000s, I'd say, because I was actually still on active duty for the California National Guard when I started first coming here up until present.
Wow, that's some time.
Yes.
Okay, and what services do you currently use, or would you recommend to women veterans?
I would definitely recommend that you seek services at the Women's Mental Health, and they have a brand new facility now in Building 600, which is just fabulous. I've received several services while I was there, and I can't say enough about the dental clinic. It's been a lifesaver for me, it really has. And also, I love the BRT. They have the patient gardens, they have wood shop, they have ceramics now, and then in whole health, they have the creative arts expression. And I'm just mentioning those because I've been involved in all of those programs, some of them still currently, because every year for the last 15 years, I've participated in the National Veterans Art Competition, and I've won national also.
Wow,
Yeah.
good job.
Yeah.
Wow, you sound like you've had a lot of services here. We appreciate you sharing. I hope some of you that are listening will take advantage of those services. What are some of the upcoming events women veterans may be interested in?
Well, the upcoming events that they currently have that I'm aware of are I myself am the Women Veterans Social Connection Coordinator here at the Long Beach VA. We are going to be having an event on June 5th in the Egg. That's our next upcoming event. Currently, they also have the VA Bowling Summer League, which I'm involved in, and that's at Cal Bowl. It's on Thursday nights at 1800, and we need more teams. And it's a handicap league, so you don't have to be a professional or anything like that. Also, the veterans, I call them the Olympics, because when you say Golden Age Games, I'm not coming out of a nursing home. I feel as though I'm more of an athlete than that. So that's coming up. That will be June 30th through the 3rd of July. I'll be participating in 5 events. This will be my 3rd year, and I've medaled all 3 years that I've went, so hopefully I'll medal again this year. It's going to be in Tampa Bay, Florida.
Wow, amazing.
Mm-hmm.
All right. And if women are interested in some of these events, how do they hear about them?
Well, you can go to under the Sports for Vets icon, sports. I think it's sportsforvets.gov. That's where they have a lot of the programs. You can also look in your local Bulldog magazine.
Okay.
That's where I found a lot of and you can just ask. People are more than willing to help share, I believe, the information, because if you spread the wealth, the more knowledge, the better that people have. It's not hoarding it to yourself. You want to share so your fellow veterans will know. And also, I send out through the Social Connection group. They have a specific list of women veterans, and I try to send out as much information to various events that I know that are coming up.
All right, perfect. Now, is there anything that I didn't ask you that you wanted to share with women that are listening tonight?
The one thing that I would like to share with the women that are listening is that I know that there's a lot of things that happen sometimes in and out of the military, but I believe if you have the strength and the courage to ask for help, you'll be able to receive it. I myself am a MST survivor, and if it wasn't for the Long Beach VA and me enrolling in the Women's Mental Health Program, I wouldn't be sitting here where I am now, because it is really a lifesaver, and it can help change your life for the better.
Thank you, Raine. Thank you for being here tonight. Really appreciate you.
Thank you.
Yeah, thank you, Raine. Always great to hear from you. And man, what a great resource y'all on the call have here. Raine's awesome. So, all right. So we're going to actually go on to our first poll question here. We are going to, let's see, you can vote by pressing the corresponding number on your keypad. And if you're online, you can vote by selecting your response below the streaming player. So please respond to this statement. I have been called Mr. at VA Long Beach. 1, for no, I have not been called Mr. 2, yes, while I was waiting for an appointment in primary care. 3, while I was waiting for an appointment in specialty clinics. 4, yes, when I was called on the phone. And 5, yes, during another scenario not listed here. So we'll have those results for you in a few minutes. And then just a quick reminder, if you do have a question, you can press *3 on your keypad at any time to get into the queue and ask that question. If you're participating online, you can submit your question below the streaming player. All right, up next, we've got an interview with Veronica Pallid and the Women's Mental Health Center.
All right, it's Lori. I'm back here again, and we all heard Raine talk about her experience with the Women's Mental Health Center, and so ironically, we have Veronica Pallid here to talk more about it. So thank you for being here today, Veronica.
No problem. Anytime for women veterans.
All right, so tell us about the new location for the Women's Mental Health Center, and especially how it has its own private entrance.
Yes, so we are on building 600, and we are located in Suite 1200, and we are actually towards the back. So the closest entrance for us would be through Engineer Way, and you can go through there, and you can see our clinic right away. And it does have its own separated waiting room that folks can wait without being bothered by anyone else.
Is this clinic exclusive to women?
Yes.
Okay. What are some of the services women can expect to get in this clinic?
Yeah, so we have everything under the sun when it comes to mental health. For example, we have our perinatal services as well as our perimenopausal services. We have our trauma program as well as the different depression, anxiety, anything that has anything to do with mental health, even adjustment and caregiving. We also have peer services and psychiatry.
I've heard that women veterans in the past did not feel comfortable with the substance abuse program because it was dominated by male veterans. Has that changed?
Totally. We have thought about our women veteran a lot in kind of revamping our art program. So now we have a dedicated provider that sees our women veterans and also dedicated groups that are only for women in that program.
And for those women veterans that are listening, can you explain what ART means?
Oh, I'm so sorry. It's our Addictions and Recovery program, and it's also in our Building 600 and, I forgot, Suite 1500.
Okay. And if a woman wants to join one of the services you spoke about, how can she go about getting referred?
Yes, so if you are connected with our women's health, you can just request from your primary care provider or any of your primary care provider for that matter. If you are already participating in our outpatient program for mental health, you can just request it from your BHIP team and they will be able to refer you to our women's services.
Okay, so you women veterans heard it. If you're interested in the Women's Mental Health Center, please reach out to your primary care provider. Is there something, Veronica, tonight that you want to share with the women veterans that I didn't ask?
Yeah, so I would like for you all to utilize our programs. We are there for you. We have so many different things offering in terms of what our women veterans need. It is a very unique experience that you all have, and we are here for you to serve you with what you need.
Thank you so much for being here tonight, Veronica. I really appreciate it.
Thank you.
Thank you, Dr. Pallid. Really great to hear about the awesome services that we offer here for our women veterans here at VA Long Beach. All right, let's go ahead and take a look at the results of our first poll question. We asked you to please respond to the statement, "I have been called Mr. at VA Long Beach," and it looks like, I'm happy about this, about 56% of you said no, you have not been called Mr. However, we do have about 15% and 7% in primary care and specialty clinics, 13% on the phone, and 8% in other scenarios. So thank you for your feedback. Our Women Veterans Program will be working with this information for the future for sure. All right, and then just one more reminder, press *3 on your keypad at any time to get into the queue to ask a question. Any question. If you're participating online, you can submit your question below the streaming player. And next up, we will hear from Linda Garrow about whole health.
All right. Hi, everybody. Thanks for having me. I'm Linda, and I'm a nurse from Whole Health. Whole Health, for those of you who may not know, is holistic care. It's looking at our mind and our body and our spirit and all of the ways they're connected. The VA's definition of whole health is an approach to healthcare that empowers and equips us to take charge of our health and our well-being and live life to our fullest. As we say in Whole Health, we're really interested in what matters to you, not what's the matter with you. Because what matters to you is going to drive your health and well-being. Tonight, I'm going to briefly shine a light on some great things happening for women veterans at the Long Beach VA. First, I want to introduce you to Maria. Maria is a certified whole health coach, and she is so passionate about helping veterans improve their lives by engaging them in the coaching process. Coaching, you may know, is a far cry from things like making New Year's resolutions, joining challenges, or just white-knuckling it and hoping to get a positive outcome. Maria's going to meet you where you are to help you make and reach some of your personal health goals. How powerful is that? Maria can help you with things like managing your diabetes or pre-diabetes, managing your stress, managing your weight, and all those important things. She's going to put you in the driver's seat and guide you to where you want to be. I talked to her before I came tonight and asked her, how many times can our women veterans meet with you? And I loved her answer. She said, there's no set number of sessions. It's whatever it takes for our veterans to be successful. So it's tailored to you, and I just think it's incredible that the VA has this amazing resource. So what are you waiting for? Give her a call. Her number is 562-826-8000, extension 18670. Take advantage of this powerful tool. Your primary team can also place a consult for the health and wellness coaching. Next, I want to share some information about Healing Touch. Healing Touch is, as I jokingly say, the old new kid on the block. Whole Health has been really supporting the expansion of Healing Touch on our campus. Healing Touch is a relaxing, nurturing, heart-centered energy therapy that uses gentle, intentional touch to help in balancing our physical, emotional, mental, and spiritual well-being. It's classified by the National Institute of Health as a biofield therapy, and it's the perfect whole health treatment. It's similar to other ancient energy healing methods such as Reiki, acupuncture, massage, Tai Chi, and Qigong. You might be asking, well, what can Healing Touch do for me? Healing Touch is very helpful for people who have pain, headaches, insomnia, and anxiety. All we need is somebody who's trained to do it and a willing, receptive client. Many hospitals across the country are now offering Healing Touch to prepare and calm patients for things that give them anxiety and pain, such as surgery, chemotherapy, and other procedures. Studies have also shown that Healing Touch can shorten wound healing and decrease the length of the stay, the time that you spend in the hospital. How about that? Besides the list of the benefits that we've just talked about, this practice often produces a state of deep calm and relaxation. So what happens in a Healing Touch treatment? So it can be performed practically anywhere. Clients can be sitting, standing, or lying in a bed or on a massage table. The clothes will stay on. You may be asked questions about your medical history to help the practitioner have more of a focused treatment. You will also be asked for consent to be touched, or if you prefer, the work can be done in what we call your field, which is the area right above your skin and your clothes. Treatments can be brief, up to 15 minutes, or they can be longer, depending on the clinic and the situation. Does it sound interesting to you? Join us for a brief Healing Touch treatment at our 1-year-old Healing Touch drop-in clinic. We are located in Building 126 in what used to be the outpatient blood lab, so close to the front entrance, and we're there most Thursdays, first, second, third, and fourth Thursday. We're never there on a fifth Thursday or a holiday. We start at 11 o'clock. Last treatment starts at 11:45, and we're done by noon. If you're interested, come on over, join us, and check it out. You don't need to schedule an appointment. It's strictly drop-in. First come, first served. Next, I want to talk about Women's Combat Support Group. This is an online group for women with combat-related stressors, and they meet on Mondays from 3 to 4:30. The group focus is to provide a place to give and receive support and to form proactive, alternative ways of coping with combat stress. Topics will include education on PTSD, anxiety, depression, and medical issues commonly associated with combat deployment, such as traumatic brain injury, tinnitus, and sleep disorders. Other topics will include community and VA resources and coping skills for mental health. This is another drop-in group, so no need to be scheduled. They do encourage weekly attendance, and they want to let everybody know that this group, along with all other legacy groups, is going to be concluding in October of 2026. The next slide I want to talk about is a very interesting club. It's called the Women Veterans Photo Club. Are you interested in photography but you don't have a camera? No worries. Here's a great opportunity to learn using your cell phone. Join Teresa Solis and bring either your Android or your Apple phone to learn all about photography while meeting your fellow women veterans. If you're interested in this club, reach out to Teresa at womenveteransphotoclub@gmail.com. Once again, I know that's a long one, womenveteransphotoclub@gmail.com. And the last slide I want to talk about is called Women Owning Wellness. This is a really wonderful group. It's a 12-week in-person and virtual hour-long class. They meet on Thursdays, and in this class you'll learn how to optimize your physical and mental well-being. You'll also learn about Tai Chi, movement, and mindfulness. If this sounds interesting to you, please reach out to Gladys Yu, who's a kinesiotherapist in the physical medicine department. You can reach Gladys at 562-966-2875. And that's all I have. I just want to say thank you for having me, and if you have any questions, you want to reach out to me personally. My name is Linda Garrow, and my extension is 6269. So it's the main number, 562-826-8000, extension 6269. Thank you.
All right. Thank you, Linda, for all that awesome information. I love hearing about the programs that we offer. All right. We are going to head into our second poll question. So remember, you can vote by pressing the corresponding number on your keypad. If you're online, you can vote by selecting your response below the streaming player. All right. What types of whole health programs are you most interested in participating in? 1, acupuncture. 2, biofeedback. 3, clinical hypnosis. 4, creative arts. 5, health and wellness coaching. 6, healing touch. 7, meditation. 8, Tai Chi. Or 9, yoga. And then just one more reminder, if you do have a question, you can press *3 on your keypad at any time to get into the queue. If you're participating online, you can submit your question below the streaming player. All right, now we're going to hear from one of our registered dietitians, Rana Saldano, about the Women's Move program. Rana?
Hello, everyone. Thank you, Lisa. I wanted to talk to you about something that we just started. We're piloting our new program for our women veterans, led by me, and I'm also Air Force veteran, and I'm so excited to bring this to you guys. I'm one of the primary instructors with our MOVE program class, which is VA's weight loss program. And this is to create a safe space for our female veterans and then to incorporate weight management topics tailored to female veterans in all ages. We do follow the curriculum of the MOVE program, and then we will have some additional topics to include addressing women's health across different life stages and conditions, such as anemia, polycystic ovary syndrome, weight loss, and healthy lifestyle in preparation for future pregnancies and postpartum weight loss, our bone health, menopause, body image, managing nutrition and food for your families. In this program, we're looking to do about a 15-week series. We're looking to start this piloted program April 22nd of this year. These will be 1-hour sessions. It will be on Wednesdays at 3 o'clock. And if you're interested in this program, please call 562-826-8000, extension 12980. This is a number to our coordinator, lifestyle and weight management program coordinator, who is my supervisor, Anna Morales, to enroll. We do have, within the last few days, we did fill up 5 slots. We do have a total of 20 slots, and we have 15 slots available left. Again, I will repeat the number to call to enroll if you're interested in, 562-826-8000, extension 12980 for Anna Morales. Back to you, Alyssa. Thank you so much.
Thank you, Rana, for sharing that information. That's awesome. All right, let's go ahead and take a look at our results for our second poll question. We asked, what types of whole health programs are you most interested in participating in? And it looks like we got 12% for acupuncture, 9% for biofeedback, 5% for clinical hypnosis, 12% for creative arts, largest number here, 18% for health and wellness coaching. Looks like they'll be busy. 8% for healing touch, 5% for meditation, 28% for Tai Chi. That's going to be awesome. And then 3% for yoga. So thank you so much for all of that feedback. Very excited to have that. All right, so moving on to our Q&A portion. Again, if you have a question, you can press *3 on your keypad at any time to get into the queue. And if you're participating online, you can submit your question below the streaming player. All right, let's take a look at our first question here. So it looks like we've for Dr. Palad. I have anxiety, depression, and bipolar. How do I know if I should ask to go to women's mental health?
Well, it's up to you if you want to, but we are here for you. That is definitely something that we can treat in our women's mental health. We are also an interdisciplinary team, so not only do you get psychotherapy, you can also get services through our social work or our psychiatry.
All right. Thank you. All right, next question looks like it's for Linda. Healing touch looks really, really interesting, but I have MST and PTSD, and I'm scared to try it because of the touch.
Oh, okay. Well, that is a great question, and as I mentioned in the talk, healing touch is what we call a biofield energy treatment. So if you prefer, there is no need for your skin to be touched. We are happy to work in the area above your skin and your clothes because energy goes through clothes. So no need to have physical touch if you don't want it, but you will be asked and fill out a screening tool before you have any treatment. You will be asked for permission and how you prefer to receive the treatment. So thank you for the question.
Thank you so much. All right, it looks like our next question is for Dr. Swaroop. Who is my primary doctor? Is there a high turnover of doctors?
Hi, everyone. This is Bindu Swaroop, Chief of Staff here at VA Long Beach. Thank you for the question. So that is a great question. The best way to find out who your primary care doctor is to one option, call the call center at 562-826-5151. That's one way to find out who you've been assigned as your primary care provider here at VA Long Beach. Another option, and a great one that we recommend for everyone, is to sign up on the patient portal so that you can get electronic communication and message your primary care team directly through the My Healthy Vet portal. If you go to myhealth.va.gov, you'll be able to register and have online access to be able to securely message your primary care team and be able to find out who you've been assigned as your primary care doctor. Regarding the second question about high turnover, we are actually very fortunate here at VA Long Beach that we have a low turnover of our physician staff. We really focus on staff engagement, staff well-being, and working in an interdisciplinary team setting to make sure our providers get the support needed to provide the best care possible to our veterans. So while we will lose providers due to geographic reasons, personal reasons, or retirements after they've been here for a very long time, we do our best to engage with our staff and make sure that they stay with us at VA Long Beach.
Thank you so much. All right, another one for Linda here. Can you tell me more about the biofeedback and, let me scroll really quick, and how can I sign up?
Oh, sure. That's a great question. So the person who's doing biofeedback is in the Combat PTSD program. His name is Dr. Nathaniel Hawkins. And biofeedback is really a cool treatment. It's looking at something called heart rate variability. And they take a lot of their cue from the Heart Math Institute. So I believe it's a 10-week course, and you learn really how to listen to your body and how to train it to shift from what we like to call the fight, flight, or freeze system into the rest and digest system. So the concept of this biofeedback is really teaching you how to fish, not just giving you a fish. And by that I mean you can go to a therapist and you can learn about, how to become less stressed, but this biofeedback is evidence-based how to actually listen and train your body to shift. So it's a great program, and the veterans are very happy with it. Thank you.
Oh, thank you. All right, it looks like our next question here is for Ms. White about transportation. They've got a question about how to get appointments and care options for emergencies.
Good evening, and this is a great question. We often get questions from veterans regarding transportation, and we want to make certain that this information gets spread far and wide. First, let me respond with, if you believe you're experiencing a medical emergency, we encourage everyone to call 911 and have transportation provided via ambulance. Now, regarding transportation to scheduled or unscheduled appointments, that's a little more tricky, and it is definitely specific to each veteran and regarding their benefits that they are eligible for. So what we ask is that you engage with our administrative staff and discuss and make certain that your information that's in the system is up to date. Our business office will help you with filling out information regarding your annual income, any sort of eligibilities that you have, as well as talking about community resources if it's determined that your eligibility does not meet the threshold for VA to provide that transportation. There are resources out there. Please do not let transportation be a barrier to receiving the medical care that you need. and we ask that you engage our teams on a regular basis to talk about your eligibility now, because eligibility, as we all know, does change. If you think that you have a reason to travel to VA Long Beach and need transportation, there are resources in LA or Orange County that's called Access. There's also transportation that's associated with your Medi-Cal programs. And then, as I mentioned earlier, I would encourage you to start a conversation with our business office. They are extremely knowledgeable, and they take the time to work with you individually.
All right. Thank you. Appreciate it. All right. Our next question, it looks like, is for Lori. We have some questions about resources for women veterans in the community, housing.
All right, that's a great question. We really recommend staying in touch with your primary care team for your health. But just so everybody knows, on your primary care team, there is access to your own social worker. So primary care social workers are amazing and really familiar with challenges vets face and the community groups that work with vets, such as the VSOs, the VFWs. They can help with some bills, car repairs, and there's the Women Warriors Foundation as well.
All right, fantastic. All right, our next question, again, is for Linda. Is there a monthly Wounded Warrior event or hikes, etc.? San Fran has one, so I have to go to that one.
All right, I know that we have, I don't know that it's called Wounded Warriors, but there is a nurse in mental health. Her name is Jeanine McGinnis, and she's created a walking, hiking group called Hikes for Heroes. And from what I can tell, they go about every month. And I believe if you find the Bulldog, she's listed in that. And if you can't find that, please feel free to reach out to us and we can get that information for you. Thank you.
Okay.
The provider that runs the Hike for Heroes is actually our peer specialist, Teresa Alcazar, and it's the first Saturday of the month. Oh. And you can just request it and from any of your provider, and they can connect you with our peer specialist.
Awesome. Thank you for that add-in. Love that. That collaboration over here. All right. Our next question is for Dr. Swaroop again. It's a question about dental help and changes for ones who have lower income.
All right, and we do have a wonderful dental department here at VA Long Beach, so thank you for the question. We do recognize that dental care is definitely a challenge. Eligibility is really dependent on your income status, service connection, and whether you're eligible to get dental care here at VA Long Beach. So as Ms. White mentioned earlier, it's very important to make sure your information is updated and correct with our business office. We do have additional options depending on your eligibility. You can go to va.gov. The VA does have some dental insurance programs at a lower cost for eligible veterans. So again, you can go to va.gov. Depending on where you live and your area, there may also be low-cost community dental clinics that are available for you to access. Your primary care team does have a social worker associated with them, and you have the opportunity to meet with the social worker to discuss other resources that may be available in your area. They often have those resources and lists available, and so you can reach out to your social worker as an additional resource for dental care.
Okay. Thank you for that, Dr. Swaroop. All right, another question for Lori. I want to get started, or I want to start weight loss injections. Do I have to finish MOVE first?
All right, that's a great question. We really want you to have shared decision-making with your primary care provider, okay? So, but you must sign up for the weekly move series. That is a fact. And then after completing your first weekly session, contact your primary care provider and request an evaluation for the weight loss medication. And at that appointment, you could discuss all the weight loss medication questions you have with your primary care provider.
Thank you. All right, our next question here is for Linda again. My primary care team keeps recommending changes to my diet and exercise, but I'm having a hard time doing those things. Is this something a health and wellness coach can help me with?
Yes, absolutely. I'm so glad you asked. The health and wellness coaches can support you in making healthy lifestyle changes, which is no small feat, as we all know. Things like eating healthier, being more active. They do this by helping you identify the goals you care about and breaking them down into smaller action steps. So it's nothing like a New Year's resolution. From there, they help you create a plan for putting these steps into action and getting connected with resources. They also serve as accountability partners, helping you stay motivated with making these changes, as we all know that change can be really hard. Lastly, our coaching model is very flexible. It's offered virtually, in person, or even over the phone. You can meet with your coach weekly, every other week, monthly, every couple of months, or whatever best meets your needs. We encourage you to give coaching a try by asking for a referral to a health and wellness coach today. You won't be sorry. Thank you.
All right. Next question here is for Raine. When is the next Veteran Social Connection? Is there one for women, and what do you do there?
The next Women's Veteran Social Connection is going to be on the 5th of June. I believe it's going to start at 10 a.m. until 1 p.m. And what we're going to do is we're going to have a few giveaways. We're going to play some games. We're going to practice journaling. And it's really just an opportunity to get to know your fellow women veterans. Also, I'd like to state that they do have the Long Beach VA Social Connection, which is the last Friday of every month. Typically, it's outside of the canteen area and the patio area, but this month, on the 27th, I believe, it's going to be extra special, and it's going to be extended up until in the afternoon, but it's going to be in Patriot Park. So that's one that you really don't want to miss, because we're going to be celebrating
Vietnam veterans.
I'm sorry, I didn't proud Desert Storm. But we're going to be celebrating the Vietnam veterans. They're going to have food trucks and all sorts of tables and activities, and also loads and loads of information for everybody to attend. So please remember the 27th of March, and it's always for the Social Connection, the last Friday of the month.
Yep, absolutely. And just talking about the Women Veteran Social Connection, the one we had in 2025 was absolutely amazing. The turnout was great. There were so many donations, and the food was great. It was just a really awesome thing to witness, and it was great. So you need to come this year as well. All right, so our next question here is for Linda. Regarding the Healing Touch drop-in clinic. It sounds interesting. Can it help me with my chronic pain?
Oh, yes, we believe so. So Healing Touch, as we mentioned, is not a pill, it's not a needle, it's not a procedure. It's simply, I call it like a massage for your nervous system, okay? So there is evidence that shows that it's very helpful for chronic and acute pain relief, poor sleep, and anxiety. We are working really hard to get staff from all areas of the hospital trained so that they can give treatments to the veterans in their areas. Yeah, that's it. So reach out to me more if you have some more specific questions. Happy to tell you what we're doing with that.
Awesome. Thank you. All right, and it looks like we've got some questions regarding submitting claims to VBA, the Veteran Benefits Administration. So we do have the VRC near the egg. We have somebody from VBA over there. VSOs all throughout LA County and Orange County are also helpful. We've also got the VA benefits hotline is 800-827-1000. And then there's also an appointment scheduler website that I always refer people to. You can contact or you can visit va.site.com/VA-VERA. And so, or if you just Google VA-VERA, VA-VERA, there is an appointment scheduler website that pops up, and you can schedule a virtual appointment or schedule an in-person appointment as well. But it's extremely helpful. I've used this one before, as well as calling the VA benefits hotline. Again, that number is 800-827-1000. All right. Our next question is again for Linda, who is the whole health coach. She looks familiar.
Oh, yes, that is Maria Valencia. She might look familiar to you because she used to work in the women's clinic for many years. So she was, I believe, an LVN, and now she's in whole health, and she has gotten board certified, national board certified to do the coaching, and boy, oh boy, is she passionate. She also knows Healing Touch, and we're trying to figure out a way for her to figure out how we can get her to do treatments, but she's very busy coaching, so there you have it. So Maria's wonderful. Give her a call.
All right, we've got a question here for Lori. We've had lots of questions about different groups and specific veteran communities, such as LGBT.
Okay, one thing that all you women veterans can do if you're interested in seeing a list of services is just go into Google, type in VA Long Beach Healthcare System. Once it's pulled up, type in Bulldog in the search box. And on the Bulldog, it gives you a great resource to a lot of services offered here, and even some services offered outside of the VA. But for LGBTQ+, VA Long Beach has a dedicated veteran care coordinator to help with any needs. Her name is Megan Mortensen. There is a group called Resilience Under the Rainbow. It's Thursdays, 10 to 11:30 a.m. You can ask your provider about getting referred to this group. It's basically a 12-week group run through the behavioral health interdisciplinary program for LGBTQ+ veterans, and it really supports feeling good, coping with negative messages, and forming a positive community. So again, please go to Google, type in VA Long Beach Healthcare System. Once that pops up in that search box, look for the Bulldog, okay? Because in there's a plethora of services available for you.
Awesome, thank you for that. All right, we've got a question about maternity. So we've got, I'm currently 4 months pregnant and recently lost my health insurance. Can I get maternity care at the VA if I only have 0% disability rating?
Yes, what a great question. All pregnant veterans who are eligible for VA health care are eligible for help with maternity care. It's part of the VA benefits package. And so, yes, you can get connected with maternity care. We have also lactation support and 2 maternity care coordinators available, Cristiana Fuentes and myself. So you can call and leave a message, connect with us by calling the main line, 562-826-8000, extension 14988. or extension 14709.
Can you mention your name as well?
Yeah, my name's Dorothy Strobel-Lucas, and
I'm one of the two maternity care coordinators and lactation consultant. And so, thank you. Great question.
All right. We might have more for this. Do we have more? No? Okay. All right. Let's see. What's our next question? All right. How do I set up an appointment for a 45-minute full-body healing treatment? Linda.
More great questions.
Yeah,
so
fantastic.
I would say for now, what we want you to do is come into the drop-in clinic, see if that's something that you really enjoy, and then find me, because I'm there every Thursday that we're operational, and just say, hey, this really helped me. I would like to get set up for the longer treatment, and we will get you taken care of.
Looks like we've got some other questions here, too. Why is the drop-in clinic only for an hour? Any plans on extending the hours or weekends?
I wish. So we do have plans for expansion, but I will say, going out, the drop-in clinic is staffed 100% by volunteers. So these are people who got the training and they're coming on their own time. They've been onboarded through the CDCE to be volunteers, or they're staff, and they're coming to give a 15-minute treatment on their break because they love it so much. So we are working behind the scenes. We're coordinating people's schedules. We are trying really hard to get more people trained, like I mentioned before, and going forward, when we expand, not if, but when, we are hoping to use massage tables in our space because it's a wonderful experience for everybody.
Awesome.
Thank you.
I think there was one other question for Linda. Yeah, how do I sign up again for the Women Owning Wellness program?
Women Owning Wellness, you're going to want to reach out to Gladys Yu. And Gladys is a kinesiotherapist in the physical medicine department, and her phone number is 562-966-2875, and they meet on Thursdays.
Awesome.
Thank you.
Thank you for that. All right, next question is for Lori, I believe. See what it is. How do you change your primary care team?
All right. Just to let everybody on the call know, we have different women's health designated primary care teams throughout our catchment area. So we have it here at VA Long Beach on campus, all the way from Laguna Hills to Gardena, although that Gardena is going to be changing to another location very shortly if it hasn't already done so. But it'll be near there. I think it's going to be in Harbor City.
Carson.
Carson. So they do services such as comprehensive primary care plus basic women's care, pap smears, put in their orders for mammograms. If you want to change with your current team, let them know your preference for location and they could submit a change request for you. Please allow time for the team to review and they'll switch your team. Your new team will then reach out to you to set up an appointment.
Awesome. Thank you so much. All right. That done for questions for now? All right. Well, if we've got no more questions, we are so happy that you joined us tonight for this Women Veterans Town Hall with VA Long Beach Healthcare System, Women's Health Team. And we really appreciate the chance to connect directly with our women veterans and address your questions. And we look forward to hosting our next Women Veterans Town Hall to keep you updated on our ongoing efforts and upcoming events. If we missed your question or if you have suggestions for future topics, please contact Lori Rudisil at 562-826-5617. All right, thank you again and have a wonderful evening.